information and then introduce you.
Yep. Sounds good.
Welcome, Joslyn Center Facebook fans, and to Interview Fridays. This is Friday, May 12th, and it looks like we're getting into that warmer weather. We have a great interview this morning. Before we get to that, I want to talk to you a little bit about what's happening here at the Joslyn Center in the coming weeks. Coming up on May 23rd is our Ice Cream Social, and that's sponsored by our friends Bill Hart's Desert Insurance. So come on by and socialize and have a little bit of ice cream. Also, we have a great event coming up on Friday, May 26th, and that's Age Well, Drive Smart, and it's education by the California Highway Patrol, and it can help you reduce your insurance costs. We would like to have you sign up, so you can call 760-340-3220 or stop by our front desk to sign up. And of course, coming up, sponsored by our friends at Desert Oasis Healthcare, is our Joslyn Center Spring Health and Wellness Fair, and that's coming up on Wednesday, May 31st from 9 to noon. And we'll talk a little bit about that in a minute or so. Also want to invite you to our Brain Boot Camp. That's a great course that was designed by UCLA Longevity Center, and it's learning how to boost your memory and brain health, and some tricks and techniques for improving your memory, but also for improving your health, because they're both very closely connected. And that's coming up on June 13th and 20th. It's a 2-session course. And also coming up on June 2nd, and it's a 5-session course, is our Aging Mastery Program, which was developed by the National Council on Aging. So a lot happening here at the Joslyn Center. We have our Go for Life program, Monday, Wednesday, Thursday, and Friday, 8 to 9. And also our counseling program, Problem Solving Strategies. If you're having stress or anxiety or depression, relationship problems, give us a call. It's offered in both Spanish and English. And to make an appointment there, please call 340-3220, extension 117. And of course, that is area code 760. So that's a little bit of what's happening at the Joslyn Center. And now we want to welcome Felice from Desert Oasis Healthcare, and we will go on with there. Hi, Felice, how are you?
Hi, Jack. How are you? I'm doing great, thanks.
Doing great. Appreciate your joining us this morning. I was hearing some statistics about the role of Desert Oasis Healthcare in our community during the COVID pandemic, and it is quite impressive. Tell us a little bit about what Desert Oasis Healthcare has contributed to our community with respect to COVID.
Sure, I'd be happy to. First, I want to say that we really value our partnership with Joslyn Center. And as you know, we've worked together through the pandemic to host vaccine clinics, and will continue to do so as the situation evolves. To date, we've administered over 120,000 COVID vaccines, which is an impressive number. And right now, we seem to be past the worst, at least for the moment. But we're still anticipating providing COVID vaccines again in the fall, along with flu shots.
Well, and that's very important. Both the flu and COVID together are a really bad combination. So we want to protect our community, and particularly those that we serve, seniors and older adults, from the effects of both the flu and COVID. Not many people really know, but the flu, as we know it, started and was a terrible pandemic in 1918, and it's been with us ever since. And I'm afraid that COVID is going to be very similar to that. So very important for people to get their vaccinations. Now, you mentioned our health fair. Our health fair is coming up on May 31st. And Desert Oasis is not only a sponsor of that, but you're doing some very special activities there at the health fair. Why don't you fill us in on those?
Sure. Yes, as you mentioned, we're sponsoring the Joslyn Center Spring Health and Wellness Fair that you have. It's one of your 2 annual, the other one is, of course, being in the fall. This time around, Desert Oasis will have our mobile health clinic on site there at Joslyn, and we'll be offering free health screenings. These screenings include blood pressure, glucose testing, and body mass index, and these are all free. We will also have staff, including a physician and most likely a pharmacist as well, who will be on site and be able to answer health-related questions.
Well, that's a great service for our members, particularly medication management. So many times people may be taking over-the-counter medications that interfere with their prescription medications. And really to have an expert go over that with them is really important. And blood pressure testing is also important. And that leads us into the other thing that's coming up, and that's stroke awareness and prevention.
That's right. In addition to our screenings, we're going to be having a health education presentation during your health fair. And the topic will be stroke awareness and prevention. May has been designated as Stroke Awareness Month by the American Heart Association. And it's important because every 40 seconds, another American has a stroke. And someone in the US dies of a stroke every 4 minutes. I myself am a stroke survivor. I had an ischemic stroke back in 2017. So I know firsthand how life-changing a stroke can be.
And it's very important that people, one, looking at you, one wouldn't expect that you would be in that risk area for people having a stroke. And you did have one. And it's very important that people recognize the signs of a stroke and what they need to do. And those first few minutes are critical.
Absolutely. The signs and symptoms of a stroke, and also the risk factors that are involved. Something that we're introducing just in time for Stroke Awareness Month here at Desert Oasis, we now have a stroke clinic as part of an expansion of our care team services for post-stroke patients. And this new clinic aims to provide optimal care to Desert Oasis patients with a history of either ischemic attacks like I had or a hemorrhagic stroke. And as you mentioned, the stroke often results in some type of physical deficit, such as reduced mobility, vision, and or cognitive impairment. So physical therapy is an important part of that recovery.
Well, that's an important addition to the services offered by Desert Oasis, and we really appreciate that. And really, for our listeners and viewers out there, the Stroke Awareness Month is very important. Come here for that lecture, learn what the warning signs are so you can take action as soon as possible, because the sooner you get to the emergency room, the less likely you are to have long-lasting impacts from that stroke. One other thing I wanted to talk to you about, we have people call us up and they go, I'm turning 65 this week. I don't know what to do. I don't know whether I should apply for Social Security. I don't know whether I should apply for Medicare. And as I understand it, Desert Oasis is now offering seminars and information in that regard. So tell us a little bit about that.
Yeah, we do. So anyone who's turning 65 can contact us, and we offer what's called a new to Medicare presentation. And we do this every month. It's offered in person and also via Zoom. And so anyone who's turning 65 must sign up for Medicare. And that can sometimes be a daunting process. So we try to help by having these meetings and having a Medicare broker do an overview presentation and then work with the individuals to help guide them along the process.
Well, and that's one thing that people really need to be aware of. They may be working and have medical coverage through their employment, but they don't know that they need to sign up for at least Medicare Part A when they turn 65. And if they don't, they could be penalized for the rest of their life in terms of higher premium costs. So it's really important to sign up for Medicare at age 65, whether you think you're going to use it or not.
Exactly. And, we always inform our members who are turning 65. We send them a letter and we let them know that it's important that you make these changes now. In many cases, if they are already not working, the current insurance that they have will no longer be accepted once they turn 65. So they are obliged to sign up for, at the very least, Part A, but typically Part A and B. And then that's another interesting area because there are so many parts that people get confused. There's Part A, there's Part B, there's Part D, which is the medical coverage, and then there's Part C, which are Medicare Advantage plans. So again, we try to have these presentations to kind of boil it all down to a more understandable format for them so we can help guide them through the process.
Well, that's great because I know, having gone through the process, it can be very, very confusing. And if you make the wrong choice, it can be very costly. So thank you for providing those educational courses to our community. And really thank you to Desert Oasis Healthcare for the impact you've had in the community, especially with regards to COVID. I think you've done more than anyone else in terms of providing those vaccines, and we should all applaud you.
Right. And one other thing I'd like to mention is Medicare annual open enrollment. So for anyone who's already on Medicare, each year, starting October 15th, there's a period of 7 weeks when they can shop around and compare plans and then select one that will best suit their health needs for the upcoming year. And this is important because a lot of people's health changes over the year, and each Medicare Advantage plan has different features. Some offer, for example, more coverage for eye exams or hearing exams. And it depends on what your particular needs are in the coming year. So come that time of the year, come October 15th, we will be holding meetings again in person and via Zoom, where we'll invite in a licensed Medicare broker, and they'll discuss what's new and help the members select a plan for the coming year.
And that's important for people to understand, is that traditional Medicare, even if you get a supplemental policy, may not cover, and traditional Medicare doesn't cover vision and hearing and dental and those other things that may be covered in the Medicare Advantage plan. So it's really important, because those can be expensive components of your Medicare, of your medical care as you grow older. So that's great information for people to know. So thank you.
Sure. And I just want to say that we have information on all of this on our website. Our website is a great resource for people. We have not only information on Medicare, but we have information, for example, this month we have links for stroke awareness, for resources for that. We also have a list of our primary care physicians, which is updated monthly, and information on our health services and programs. So I encourage everyone to come and visit our website. It's mydohc.com, mydohc.com.
And it is a great resource, and people can find out a lot of information on that. It is mydohc.com, and visit that and get your questions answered. So anything else you want to cover, Felice?
No, I appreciate working together with the Joslyn Center. You're a great partner and a great resource in the community, and I look forward to seeing you all on the 31st for the Spring Health Expo.
We will see you then, if not before. Thank you so much for joining us today. And for you and for all our listeners, have a great weekend, and we'll see you next Friday for Joslyn Interview Friday. Thanks, and have a great day. Bye-bye.
Thank you. Thanks.